Hello, everyone, and welcome. My name is Courtney Goodwin. I'm the social media manager at Prisma Health. On behalf of Prisma Health, we would like to thank you for joining us for another Facebook Live Town Hall. At South Carolina's largest healthcare system, we spend a lot of time providing information to our communities to ensure they have the information that they need. May is Mental Health Awareness Month, an important time to raise awareness and to reduce the stigma surrounding behavioral health issues, as well as highlighting the ways how mental illness can affect all of us. So today we have a great panel of experts who will answer questions and also share and recognize the signs of mental health illness. So on our panel today, we have Dr. Frank Clark. He's an adult psychiatrist in the Upstate. We have Dr. Shilpa Srinivasan, geriatric psychiatrist in the Midlands. We have Dr. Michael Sierra, child and adolescent psychiatrist in the Upstate. And we have Dr. Stephanie Berg, psychiatrist in the Midlands. So thank you all for joining us today. So let's get started with our first question. And this question will go to Dr. Clark. So let me pop you up here. All right, so the first question is, are more people struggling with mental health since the pandemic began in 2020?
That's a good question, Courtney, and unfortunately, I have to say yes. So there's been a lot of data looking at the emotional toll that the pandemic has had on just our population. And so there was one study in 2021, for example, that showed that half of Americans surveyed reported recent symptoms of anxiety or depression. 10% of those respondents felt that their mental health their needs were not being met. We also know that according to the World Health Organization, that the global prevalence of anxiety and depression increased by 25% when the pandemic started. So that just gives you a good illustration, so to speak, of how the pandemic has impacted people's overall health. The last thing I would note would be that having the COVID virus, for example, you can also have psychological or psychiatric manifestations with the COVID infection that can include depression, anxiety, some mental fog, so to speak, where people have difficulty remembering things. So we have the pandemic in itself that has impacted people's mental health, but also the virus.
Thank you. All right, so the next question will go to Dr. Sierra. All right, so your question is, what are some signs of stress in adults, and do children show different signs of stress?
Yeah, good question. So the first thing that we need to recognize is there's types of stress. There's like good stress and bad stress. So stress is a word that we use to say that something is psychologically challenging, and we need challenges to grow and develop. But sometimes stress can be overwhelming and hurt us psychologically, and that does look different in adults and children. So adults, they tend to internalize bad stress, so they feel more sad or anxious or withdrawn. They might want to escape with lots of television or substance abuse. And children tend to externalize bad stress or act out. So they might get aggressive or defy or throw tantrums or curse or scream, things like that.
Thank you. All right, so now we will move on to Dr. Srinivasan. All right, so your question is, does mental health concerns like stress, anxiety, or depression affect your physical health as well?
Absolutely. Thank you for that question, Courtney. And first of all, good afternoon, everyone. Thank you for this opportunity, and thank you for joining us on today's presentation. In regard to whether stress, anxiety, or depression affects our physical health, there absolutely can be a relationship between those. I like to say we don't have a steel plate that separates our mind from our body, so what affects one affects the other. As we heard from Dr. Sierra, there can be different types of stress, and really what we're talking about is when stress gets clinically impactful or significantly overwhelming, or if there are clinical conditions like anxiety or depression. All of these can actually have an effect on our body's own stress regulatory system, something that we call the hypothalamic pituitary adrenal axis, which we commonly know as stress hormones. With uncontrolled anxiety, depression, or chronic stress, these hormones are increased in their release, and this can in turn have downstream effects on other parts of the body, things like on our blood pressure system, on our vascular system, on other aspects of physical functioning. So uncontrolled anxiety, depression, or chronic stress exposure can have negative impacts on physical health concerns like high blood pressure, like heart disease. And it has also been shown to be linked with other medical conditions. In addition, if someone already has existing medical conditions, whether it be diabetes or cardiovascular disease or cerebrovascular disease, uncontrolled depression or anxiety can have a negative impact on the control over those conditions. So it's really what we call a bidirectional relationship or a two-way street. So we really need to ensure that we address not only physical conditions, but mental health conditions in tandem. So this really needs to be a joint approach. Thank you.
Thank you. That was great information. So now let's move on to Dr. Berg. All right. So can you be suffering from depression without knowing it?
Yes, absolutely. And again, thanks for asking me to participate. I think this is so important for us to be talking about, especially this month. But building on what Dr. Srinivasan was saying, that there is such a relationship of the mind-body connection. And oftentimes we don't appreciate the effect of the depression and anxiety on other physical conditions and vice versa. And so symptoms that we see with depression, we see certainly sadness, but to me, the core symptom of depression is lack of interest in things, just no color in this world, not able to find enjoyment. And that really can feel like you're sick. Like we see that when people are sick with the flu, with COVID, whatever it may be, a viral illness. And so it's that blah, no color in this world, no interest. And we see sleep problems and concentration problems and appetite changes and feeling really weighed down. And it can be very, very difficult to tease apart, which is because of a physical illness otherwise, although psychiatric illness is a physical illness. And therefore, when those symptoms are increased with no interest and no energy, not sleeping well, it can often be mistaken for a physical illness. And it's really important to make sure that we are evaluating for psychiatric illness in addition to the physical symptoms.
Great, thank you. All right, Dr. Clark. So your question is, what are some steps people can take to support their mental health at home?
Thank you for that question, Courtney. So I think there are multiple steps that people can take to support their mental health at home. I'm a firm believer that we have to be mindful of how and where we invest our time and energy. And so, every day we are so inundated with emails and text messages and breaking news. I think one of the first places to start is probably to take a time out from our phones. I find that can be helpful for us to really be mindful in terms of our mental health. One of the other things I think is important is to make sure we are always, or at least try to be present with the people that care about us and that we care about them. So for many of us, that's family and friends. There's something to be said about when we look at the studies in terms of longevity. What we find is that social relationships, right? The relationships are one of the key components to living a long and prosperous life. So I think that's one thing also to be mindful of. And then common things are common. We can't ignore the benefits of exercise. You don't necessarily have to go to the gym in order to exercise. If you have a device, whether it be a laptop or a phone, you can go on YouTube and do various videos, whether it be yoga, different types of stretching, cardio, whatever it may be, whatever interests you. I would say I would definitely put a plug in for that. And then also the last thing would be staying hydrated. I can't tell you how important it is for us to drink water. Now, I'm not saying drinking copious amounts of water, but a couple of glasses a day can keep the doctor away.
Yep, Thank you so much. All right, Dr. Srinivasan, I have a question for you. So how does someone know if they need to see a doctor about their mental health?
Absolutely. That's a very valid question, Courtney. So I think while we all experience different types of pressures in our life that may have an impact on us emotionally, it's important to recognize when our own coping mechanisms are starting to get overwhelmed, where the things that we may ordinarily be trying to do or are doing to keep up with those pressures or to continue to maintain our usual selves despite those pressures may not be working or serving our purpose as well. So sometimes what we think about as physicians is when we often see patients, it's because what they've tried to do has not helped, or perhaps their usual coping mechanisms have been overwhelmed by the situation at hand. And sometimes it's difficult for a person to recognize when that's happening, either because of the severity of their depression, or as Dr. Berg mentioned, when everything seems so overwhelming that it just causes the shutdown. Then sometimes family members, loved ones, or friends are often the first to pick up on this sort of change. So when there are changes or an impact, a negative impact on a person's ability to engage with their loved ones, their family members, their friends, their social circle, what we call interpersonal relationships, that can be a sign. In addition, if someone's working or is in school, changes to their ability to carry out their workload or their school load or their course load to the degree that they were before because of the impact of anxiety or depression, that then has this negative ripple effect on functioning in other spheres of a person's life. That can be a warning sign as well. So essentially, at any point when a person feels as though they are getting overwhelmed, it's helpful for them to reach out to talk to someone. It may not have to be a healthcare professional, but certainly getting input from family, friends, and seeking professional help whenever there is the inkling that perhaps the usual coping abilities are getting overwhelmed, or that symptoms or mental health conditions are having a negative impact on a person's social, occupational, or professional and academic functioning would be a good and clear sign to seek professional help.
Thank you. That was such great information. All right, Dr. Sierra. What does it mean to be a helicopter parent, and what can people do about it?
Good question. Yeah, helicopter parenting is more than just hovering around your children and keeping an eye on them. Children often need supervision. The hallmark of helicopter parenting is the parent is hovering around the children to swoop in and fight their battles and fix their problems. Kind of going back to the stress question, it's a good tactic for eliminating bad stress when appropriate, but it does sometimes eliminate the good stress that they need to gain independence. So it's very important to balance, being protective and nurturing with encouraging someone to do for themselves when appropriate. So a lot of parents, they want their children to have good self-esteem, and that comes when the child themselves is able to turn their failures into victories without help. So, yeah.
Well, thank you, because I did not know what that meant. So I appreciate that. All right, so Dr. Berg. So a patient wanted to know, what is mommy brain? Is it a real thing, and what can you do to cope with it?
Oh, I'm so glad you asked this. This is a huge topic. So I apologize. And it's also something I'm very passionate about, being a perinatal psychiatrist. So I think what we're talking about with mommy brain is really all the changes that happen when somebody is pregnant and having a baby, a new child, whether it be their first child, whether it be their second child, whether it be their seventh child. And so pregnancy and postpartum are a time of huge transitions physically, with huge hormonal shifts that can cause mood issues. Also changes in family dynamics, again, whether it be your first child, whether it be your third child, and also with life transitions with us and as women in our lives. So what we see are cognitive changes, so changes in thinking. We also see mood changes. And when we talk about mommy brain, the phrase mommy brain, what we're thinking about is thinking changes, cognitive changes. And evolutionarily, our brains have been, we've developed to have these changes. So what we'll see during that time period is women being much more vigilant, because we're having to take care of these helpless little creatures that can't feed themselves, take care of themselves, protect themselves. So we're learning how to be mama bears and fight for our offspring. So we see that moms are much more in tune with nonverbal cues in their babies and other people. And we see that moms have a change in kind of executive functioning in terms of having to multitask, because you're in charge of another person's life, and in addition to yours at that point. So we see a lot of changes with that. Now, unfortunately, our brains only have so much capacity. So we do see the positives with the vigilance and the nonverbal cues, but what we do see is some differences, some decrease in memory. So it can be verbal memory, that could be forgetting somebody's name, could be forgetting why I went into the kitchen to get something. And we definitely do see cognitive changes that the studies have shown that. Now, what we do see emotionally is a lot of changes with pregnancy and postpartum. So it is the majority of women after delivery who have what we call postpartum blues or baby blues. And during that time period, it's usually up to 2 weeks, moms will be more emotional, crying more, we see mood fluctuations up and down, mood swings. But generally, moms are functioning really well. They're bonded with their baby, they're eating, they're sleeping when the baby sleeps, and that's a big cue, is that they're able to sleep when the baby sleeps, and really learning this new person. In contrast to that is postpartum depression, where we see moms having the symptoms of a major depressive episode. So not being interested, not being bonded with the baby, they're not able to sleep when the baby sleeps, they're not functioning, they're not eating, and unfortunately, the worst case scenario with that is having hopelessness or suicidal thoughts. And so that is something that we watch for. This time period is a time of high risk for depression, and we really do want to monitor that closely. It's also a high risk time period for anxiety, and we're starting to identify even more difficulty with anxiety postpartum and in pregnancy, and that can take the form of intrusive thoughts of what if I drop the baby, what if I throw the baby, and these are thoughts that are terrifying to a mom, and mom would never act on it, and they are we call them intrusive thoughts, because they're thoughts that just don't feel like their own, and they're oftentimes people say, well, where did that come from? That's nothing I would think of. I would never do that. This thought is terrifying for me. And therefore, moms will avoid things, like they will avoid going into the kitchen where the knives are, or going into the bathroom where they're bathing the baby. And they're very disturbing. But intrusive thoughts, even milder forms, are in 90% of new moms and new dads. We think about it as moms checking on babies overnight. Are they still breathing? Are they still breathing? And that's an adaptive brain change that comes with being, mama bear or papa bear. So as long as these thoughts are not causing lifestyle changes or causing impairment, then we look at them as a pretty normal part of the postpartum. But it's when they get to the point where they're causing problems, like moms aren't functioning, they're not taking care of the baby, they're avoiding things, then we do start worrying about that. So there are a huge amount of changes to the brain, to families, to moms after with pregnancy and with delivery, and mommy brain can include so many different things. So it's definitely something to think about, and something that there's just more and more research on every day and every year. So great question.
Thank you so much for providing that valuable information. Thank you. All right, Dr. Sierra. So your question is, how can someone help their child if they're going through a divorce?
Good question again. Yeah, divorce can be psychologically disruptive for children, and there's certain things that are true no matter what the situation, I think, apply to divorce. So children they're very good at thinking that things are their fault when they're not. So I think one thing to remember is reassuring the child that, you know, the situation between, you know, the couple is separate from the situation between the children. You know, children do very well with routine and predictability, and this is gonna, you know, be an adjustment. So giving them a lot of information on why this is happening and what's gonna change is really important. Try to create a new routine as much as possible where they still get access to, you know, their network of family members and friends that they're used to seeing. The children are gonna feel like a big loss of control, and they don't have a lot of control to begin with. So giving them an opportunity to share their concerns or give input in some of these new routines could be helpful. It's important to not bad talk the other parent, you know, and be patient. You know, kids are pretty adaptable, but they need time. So being patient with them to give them time to adjust to the new routine could be useful.
Thank you. All right, Dr. Clark. Your question is, how can you tell if you're in an unhealthy dating relationship, and are there ways to fix it?
So that's a very good question, Courtney. I would say the first thing that comes to my mind is that you know, relationships are they need to be reciprocal. They're not one-sided, and so if there is a lack of trust in the relationship, that doesn't allow for very good building a solid foundation, especially if this is someone that you're thinking that you may want to pursue marriage in the future or wanting to have children with this person. So I think if there is any type of mistrust, if the person is not a person of integrity, that can contribute to an unhealthy relationship. Infidelity obviously is one of those things that we see in relationships that can definitely impact or fragment the relationship if it was already fragmented. I think the other thing would be looking at how your partner treats your friends, how they treat their family, how they treat others when you're out at dinner. Sometimes it's not necessarily what they're saying, but what they're doing. So do their words match their actions? If there is some incongruency there, that may be a sign that it's an unhealthy relationship. I think we have to talk about abuse. So abuse comes in many forms. I think a lot of times people don't realize they're in an abusive relationship. And some of that, I think, goes to the point of, well, that person is not physically hitting, you know, and inflicting physical harm on me. And I think we have to be mindful that abuse comes it could be verbal, psychological, emotional abuse. And so I would encourage our audience members to be mindful that if there's any type of abuse, that would not be consistent with a healthy relationship. There are many ways to, I guess the question is about how do you fix it? So I think that also depends on the relationship. There are some relationships where, for example, there's infidelity and the couple decides that we're going to work this out. For some people, they may decide to terminate the relationship. And I think that really has to depend on the person's values and how they view the relationship. Do they feel like it's salvageable? I'm a firm believer of therapy. If you think that the relationship is able to be mended, then maybe you talk about couples therapy. But again, it can't be one-sided. Both parties have to be dedicated and committed to making it work if they want to have a prosperous relationship. And then lastly, if you are in a domestic violence situation or intimate partner violence, if that relationship is abusive, making sure that you're reaching out to people that know you and care about you and asking for help. There are plenty of resources in the area that are provide safe havens for individuals who are being abused.
Thank you, Dr. Clark. Dr. Srinivasan. So what is mindfulness meditation and how does it help?
Yeah, thank you, Courtney. That's a wonderful question. So mindfulness meditation, if we kind of break down what the two words are, there's mindfulness and then there's meditation. Mindfulness is a state of being aware non-judgmentally about what is going on within the person and around the person. So it's an awareness of our emotional state. It's an awareness of our physical state and our environs, but it's an awareness with this sense of curious attention and not judgmentally. So not trying to ascribe a value to what we are feeling, rather to notice and acknowledge and observe what we are feeling in the moment. So it's being very present in the moment. Meditation is a practice. It's a way of achieving that state of awareness, and the two together, mindfulness meditation, is just one of very many different forms of meditation. But the whole premise of this is essentially to be in this non-judgmental state of awareness about oneself and being in the moment versus giving in to or letting one's mind perhaps fast forward into the future, the what if thinking, or reverse into the past. Why did I do this? Why did I say that? Why did this happen, etc.? Mindfulness meditation is, again, a strategy. It is a practice. It's not a one-time occurrence, and is something that really can be incorporated into day-to-day life with very little to no equipment. You don't need a gym membership or a yoga membership to practice mindfulness meditation. There are a lot of strategies that can be used. Some strategies that can help guide mindfulness meditation is the use of things like guided imagery or deep breathing exercises, or even what's called a body scan, of starting with one part of the body, like the toes, and really working the way up with just an awareness of what is that part of the body feeling like, what's the air around that body feeling like, what's the situation there, how tense is it, how relaxed is it. But again, not forcing the body or the mind to be in a different state. Now, sometimes we confuse meditation with emptying the mind, where our mind has to be blank of everything, and that's not necessarily the case. Rather, with mindfulness meditation, it's accepting kindly, compassionately, and non-judgmentally how we're feeling. So we're not beating ourselves up about what we're feeling, but rather allowing ourselves the opportunity to feel those emotions, but then moving on from that through the use of other strategies like deep breathing and relaxation to work through what is going on in the moment. What's also important and helpful to recognize about mindfulness meditation is it's not something that needs to be used only when there's a problem or there's a stress. It can certainly be used during those instances, but with a daily or a regular practice, this becomes more fundamental and natural to oneself, so that when there is a stress, the use of these techniques becomes a natural response and not something that has to be specifically or deliberately mobilized in the moment. A helpful acronym for mindfulness meditation can just be STOP. So in a time of stress or in a time of even an emotional change, to stop what one is doing in the moment, maybe just take stock of the situation. And so S is stop, T would be take stock of the situation. That could be through some deep breaths, maybe the body scan, maybe it's a brief activity like a walk. The third, which is O, is observe what's going on internally with one's feelings as well as outside in the environment. And then P would be to proceed from that point through next steps with that sense of awareness and with that sense of mindfulness. In general, mindfulness meditation has been studied as of various other types of meditation and have actually been shown in research to change neuroplasticity or brain connectivity to enhance one's ability to be more resilient in the face of stress, to even help with conditions like anxiety or depression, along with other treatments. So this is really a strategy and a practice that can be utilized by anyone, anywhere, at any time.
Well, thank you for the explanation and the examples. I appreciate that. Dr. Sierra, have you up next. So what is ASMR, and is it really a thing?
It's really a thing. Yeah, ASMR stands for Autonomous Sensory Meridian Response, which refers to this tingly feeling that you get that typically starts from the head and works its way down, kind of like a shiver. And it's one of the most popular search terms on the internet, like sites like YouTube. And there's millions and millions of views on ASMR. So what might you see should you search for ASMR on the internet? It's a lot of videos that have audio and video cues that can trigger this response. So lots of mouth sounds like gentle whispering or like the clicking of the tongue. Certain items like crinkly items like paper or styrofoam. It's like the audio is very, very tuned in to pick up lots of sounds that normally are really hard to hear. Sometimes preparing or eating food is associated with ASMR, and it's inducing what could be kind of a relaxing, satisfying video / audio thing to consume. You know, kind of to piggyback on the mindfulness, it's something that can bring you into the moment where you're not thinking about the past and the future, and it can help you kind of feel relaxed. And yeah, it's gaining popularity.
Thank you. All right, Dr. Berg. What's the best way to deal with conflict in the workplace? And how do you know if you're being bullied at work?
Yeah, so our workplaces have had a lot of transition over the last 3 years. We've all gone virtual, we've gone back to virtual, we've gone hybrid, and it's been a big transition for all of us, with a lot of stress and a lot of different personalities coping in different ways. And we all spend usually about a third of our lives at work, and so there's different personalities that can have a lot of conflict, and for lots of different reasons. So I think, and it's really important to look at the fact that there is a conflict, and look at it directly in a non-judgmental sort of way, which is very difficult for all of us to do, but to look at it in a very non-judgmental sort of way and have a direct conversation with the person that may be that you may have an issue with. And it's important to make sure that you're going about this in an appropriate way in the workplace, in terms of speaking with managers, and always having assistance from HR can be very helpful too. Now, when we look at bullying in the workplace, so about 19% of people have been directly bullied in their lives, and an additional 19% of people have noted that they've seen people being bullied in the workplace. And I didn't realize this, about a quarter of people who leave their jobs say it's because of bullying, because it is so it can be so prevalent. You know, we all think, well, that's just something that happens in school when we're growing up, that we're trying to, of course, as a society, we're trying to work on that, but it happens in the workplace too, as adults. And bullying can take lots of different forms. It can take form of gossiping, somebody gossiping about their coworkers, and it can actually turn into kind of a mob bullying, where one person is the ringleader and then pulls in other people against a person who's been singled out. It can be giving somebody too much work and deadlines that they just can't meet because it's unreasonable. Or it could be giving somebody not enough work, so setting them up for failure and they don't reach the promotions that they would normally be achieving. It can be intimidation. It can be inappropriate comments. And it could also be stalking or a lack of privacy, where invading people's emails. And it's important to maybe try dealing with somebody directly, but oftentimes that doesn't work with bullies. And it may be pulling in management, pulling in human relations. And it can be very, very difficult to get out of a bullying situation. There are lots of reasons why people stay. Could be financial concerns, could be a lack of confidence at that point, because bullying certainly undermines people's kind of core sense of self. Could be socially, they don't want to leave behind the people that have been their coworkers, kind of their peers there. And it can be very difficult to think about leaving a job and going to a new one when you're not sure how things are going to have been left in the workplace. But again, certainly Prisma has a culture of no tolerance for bullying, and having your human relations department assist you could and should be helpful with a situation like this. But it is very toxic to be involved in something like this.
Thank you so much for answering that question. Dr. Clark, I have a question for you here. Is it normal to talk to yourself, and what can you do to control your inner dialogue?
So thank you for that question, Courtney. Yes, it is. We all have that internal dialogue. I like to refer to it as chatter, so to speak. And you know, to piggyback off of what Dr. Srinivasan had said as it relates to mindfulness and meditation, I think oftentimes when we are having that internal dialogue, it's oftentimes thinking about the past, thinking about the future. We rarely stay in the present. And so one of the things that I like to encourage people, and myself included, is that it's okay to have negative emotions. We often judge our emotions, and actually judging our emotions, this then can lead to people feeling even more sad or depressed if they were already feeling that way. So we were created to have human emotions. That includes fear, that includes anxiety, that includes, sadness. There's a part of our brain called the limbic system that, where those things can manifest itself. For example, if you see a bear, you want your limbic system in control, and you're going to have that either fight, flight, or freeze mentality there. So when we are having that chatter, just being mindful that thoughts are not facts. I'll say that again, our thoughts that are not necessarily facts. And so one of the things that I find helpful when I have my own internal dialogue, my own chatter, is to implement that STOP acronym that Dr. Srinivasan so eloquently illustrated. You can always think about positive affirmations. That the positive affirmations can change the brain. So you can say, instead of I feel like a failure because I didn't do this, or I should have done this, and I'm regretting this decision. You can rephrase that and say, I did the best that I could. I gave it my all. I am a person that is still growing in my career, whatever it may be, and that can be helpful for that chatter, so to speak. But I just want to encourage people to not judge their feelings, acknowledge them, accept them, and then figure out, okay, why am I feeling this way? And I think that will help us all, lead better lives and prosper.
Thank you. Dr. Sierra, the question for you is it unhealthy to binge watch shows? How do you know if it's a problem?
Yeah, so binge watching shows in and of itself isn't unhealthy. I think the question to ask is, what is it replacing? There's only so many hours in a day, and we know that it's unhealthy to not get enough exercise, or not get enough sleep, or not get enough socialization in real life with friends, or to neglect household chores or things like that. So if you're spending too much time indoors on the couch eating unhealthy foods, watching TV, and neglecting important areas of your life, then binge watching shows, this may be a concern. And a lot of media consumption is addictive, intentionally. But if you have a favorite show that you've waited all year or 2 years for it to come out, and you want to watch it all with a loved one in 2 or 3 days, that can be a perfectly healthy, enjoyable activity.
Thank you. All right, Dr. Srinivasan, the question for you is, how can you tell if someone is gaslighting you, and how should you respond?
Yeah, thank you, Courtney. That is indeed an important question. So we heard a little while ago from Dr. Clark about relationship dynamics and considerations of when relationships are unhealthy or abusive. Well, gaslighting is a form of psychological manipulation or abuse where the person who is gaslighting someone else fosters this sense of self-doubt or confusion in the person who's being gaslighted. And it's a form of control, a form of manipulation, and it's a form of undermining the other person in the relationship. Gaslighting typically is seen to occur in intimate relationships, but can occur outside of intimate relationships and outside the romantic space. It can occur in other social relationships or even in the workplace. When it does occur in intimate relationships, actually, according to the National Domestic Violence Hotline, 3 out of 4, so almost 75% of female victims of intimate partner violence have reported gaslighting by their partner or their ex-partner in the context of their relationship. So this can be a very significant and serious issue. How to tell if one is being in this situation is typically when there is commentary or dynamics in the relationship that makes one question their self-worth, maybe even question their sanity, because comments about something that they heard not being said, or maybe even outright lies about how a conversation went down or how an interaction went down. Sometimes there can be blame shifting where the perpetrator of the gaslighting behavior says things to the effect of, well, I wouldn't have said that if you didn't do this or if you didn't behave like that. So shifting the blame onto the victim in some ways can also be seen. Another thing that can be seen that can be a clue to being gaslighted is when there's minimization of the situation, or the person being accused of being too sensitive, or that this is not something that they should get worked up about. So it can be a very toxic situation. And unfortunately, being exposed to and being in a relationship that perpetuates gaslighting is actually linked with negative mental health outcomes, including things like anxiety, depression, or even post-traumatic stress disorder. So it's important to try to recognize when this is going on. Unfortunately, it's not always readily apparent because of the power dynamic in the relationship, and also because, particularly in intimate partner relationships, the person who is gaslighting the other individual tries to draw their victim away from their supports, their family, isolates them from family members. So if anyone feels or is concerned that they are being a victim of gaslighting, the first thing they should do is actually talk to someone about it and not keep that to themselves, which seems counterintuitive because the whole perpetration of this process leads to the sense of self-blame and low self-worth and low self-esteem. So actually doing something in opposition to that may be very difficult to do, but can be a critical first step in talking to someone, reaching out to family, not allowing that isolation to happen. And of course, in examining that relationship or that situation to seek professional help, particularly if there is the tendency to fall into issues related to anxiety, depression, or negative mental health consequences.
Thank you so much for answering that question. That was very good. So this next question is one that is very timely and it requires some type of conversation. So Dr. Clark, I'm going to pop you up for this next question. And the question is, with the recent rise in mass shooting events reported in the news, how do you advise your patients who may be struggling with feeling safe to do their normal activities?
Courtney, thank you for that timely question. But we could probably spend a whole hour on this question alone. So, I think we would be, we can't be naive to the fact that we are living in a society where these mass shootings are becoming breaking news daily. We've seen it happen over the last several weeks. I think it's important for the patients that we care for, but because we're all patients, we all go to the doctor. I think it's important to be able to still, we can have the fear, we can acknowledge that we are fearful, because we all, I think we would be, we wouldn't be truthful to ourselves if we didn't say that these mass shootings are impacting how we are viewing society right now. You know, I'm a family man. I'm a father. I have a daughter. I have a wife. You know, when you become a parent, you think about things differently. And so I think that it is important for us to acknowledge, but also to still do the things that bring us meaning. I think that's one of the best ways we can take care of ourselves, especially during these dire times, so to speak. I am a firm believer, and this is just my opinion, that it is good to take a break from the media if at all possible. Now, with that being said, I do think that we need to be informed, but I also think we don't need to be too informed. So I think that there is a balance. I don't think we should necessarily just pull the wool over our eyes and say like, and that we live in a utopia. I don't think that's necessarily healthy. But I also, at the same time, don't think that we should be constantly watching videos every time that there is a mass shooting, or other things that are going on. So staying in the present, I think we should still be able to do those things, like go to the mall. Like if people like traveling, for example, you should still get on a plane and travel. We dealt with this when we had the COVID pandemic, right? You know, there was a lot of fear of, you know, am I supposed to be distancing myself from someone? Well, we talked about 6 feet apart, but that doesn't mean we were encouraging people to not still bond with people, right? We know the importance of relationships, and I would say the same thing as it relates to mass shootings. I think it's important for people to do the things that make them happy, that bring purpose. So if that is still going to the gym, go to the gym. If it's going to the mall, go to the mall. If it's, you know, we've had shootings at hospitals. You know, I would not encourage my patients to steer clear of hospital settings because there have been shootings. You know, I think we can be mindful that, yes, for some people, when they step into a hospital, that may evoke some fear because of what they've seen on TV, or maybe they've had their own trauma from going to hospitals. But we don't want to avoid, we still want to confront our fears, but we want to be able to do it with a support system. And I think that's my last point that I would like to take home point regarding this topic of, it takes a village. In order for us to thrive in the midst of all of the violence that we are seeing, that is continued to persist in our country, it's become the status quo. We need each other to be able to feel whole and to make sure that we are living our best life despite the darkness that sometimes comes about.
Thank you. That was very good. Dr. Berg, do you have any thoughts on the question?
Just building on what Dr. Clark was saying and said so eloquently, is I think there are certain populations that we need to be extra careful to monitor mental health. So people who have a history of previous trauma and have post-traumatic stress disorder, where they have nightmares, flashbacks, hypervigilance, things that they avoid, kind of a lot of negative thoughts, that this is a population that can be at higher risk of the post-traumatic stress worsening with each cumulative trauma that we are bombarded with daily, and especially, like Dr. Clark was saying, in the media over and over and over again. So I think we in the mental health world are seeing a lot more of the post-traumatic stress symptoms coming out, and that people who do have post-traumatic stress do need to be vigilant and make sure that they are seeking help for this.
Thank you. Dr. Sierra, any thoughts or comments?
The topic of mass shootings comes up. I'm often reminded of a quote that Fred Rogers said once on, I don't know if it was on the show, Mr. Rogers' Neighborhood. or if it was just in an interview, but he has a quote where he says, "When I was a boy and I would see scary things in the news, my mother would say to me, 'Look for the helpers. You'll always find people who are helping.' To this day, especially in times of disaster, I remember my mother's words, and I'm comforted by realizing that there are still so many helpers, so many caring people in this world." And I think what these mass shootings do is there's a reminder. It reminds us that there's still like hate and brokenness in our society, things that we need to fix. But if we avoid it and go into our shells, I think that just makes the situation worse societally. So it's kind of like, we look to, politicians or school boards or law enforcement. We look to a lot of people to be the helpers, but we also could try and aim for, it's hard, to be courageous ourselves and do what we can in our spheres of influence to become a helper too, and to try to develop a society where love and unity and caring for one another prevails.
Thank you so much. All right. Dr. Srinivasan, have you up here.
Yeah, I mean, I think my colleagues have, again, so artfully and eloquently said so much of it that I echo those. I think the other component of it is also to recognize, as has already been shared, that when in times of distress, particularly distress on the scale that mass shootings tend to evoke, we either look for answers outside of ourselves or look for answers inside ourselves. And sometimes there aren't answers to be had. But I think if we foster a sense of everything is out of our control, then it can perhaps sometimes lead to that excessive or exaggerated fear response, as Dr. Clark mentioned, where if a shooting happened in a hospital, that a person would avoid the hospital entirely, thinking that's going to be the way to control the fear response, but that may not necessarily be adaptive. Rather, looking to other adaptive coping strategies closer to home, things that we draw upon that are based on our value systems and our beliefs, and that can vary from person to person. But oftentimes that's grounded in either some kind of spiritual, social, or interpersonal philosophy that can be very, very helpful, even in these times of significant upheaval and distress, like a mass shooting, which is a disaster on very, very many scales, can evoke. Dr. Sierra talked about helpers and being in the helper mode, and I would say that helpers aren't only persons of power or leadership or healthcare professionals. We can all be helpers for each other. And I would particularly point out that when there are things like mass shootings, it's important to remember that it can have an impact on individuals who may have experienced other traumas, as Dr. Berg mentioned, across the age range. So for example, if there was a mass shooting at a school, again, horrifying and such a catastrophic situation, older adults, not the same age, may not be parent age, childhood parent age, older adults can still be negatively impacted because of the traumas they experience, because of social relationships. So I think it's important when we have situations like this is for us to see ourselves as really being in that role to help our loved ones, our family members across the age spectrum. And in very many ways, it's that unites us rather than what divides us.
Thank you. All great responses. Thank you so much. We actually had a question that came in through Facebook. The question is, what is the difference between a psychiatrist, a psychologist, and a counselor? And if that person needs mental health support, who do they go to first? If you don't mind answering that question for me. Dr. Srinivasan?
Oh, sure. Yeah, that is such a great question. I'm so glad that this was posed because it's definitely something that people ask about, and they rightfully should. So if we start, a psychiatrist is a medical physician. It is someone who has undergone 4 years of medical training and then additional years, usually 4, of general psychiatry residency training after completing their undergraduate training, etc. So this is someone who is a medical physician with training in psychiatry. So a person who's a psychiatrist has gone to medical or osteopathic school and has completed an accredited residency program in psychiatry. A psychologist is also a trained mental health care provider, but is not a physician. However, they have also undergone rigorous training in the field of psychology. In some states, only psychiatrists can prescribe medications, while psychologists cannot. That is not the case in every state. There are state-by-state variations in that regulation. A counselor is also a healthcare professional, but may have had other entry points of training, whether it be undergoing a master's level training in a healthcare sphere of, let's say, social work or advanced nursing or marriage and family therapy, etc. So there are various different types of counselors and types of counseling, but this is sort of the distinction between the three. And I'd welcome my colleagues' input on anything that they would like to add to this as well.
Yeah, Dr. Frank Clark.
I echo everything that my colleague, Dr. Srinivasan, said. You know, I can't tell you how often this comes up when I'm in the room with my patient. Actually, the other day I had a patient. You know, I said, well, I hope that you will come back and see me for your next appointment, and I also think that you could benefit from having a therapist on board. And her response was, well, wait a minute, I thought you were the therapist. And I said, you know, yes, I as part of our residency training, we learn the various types of therapy, but I think it's going to be important for you to have those hour-long sessions or 45-minute to hour sessions with a therapist that is mainly doing therapy. You know, we as psychiatrists, we are always doing some type of form of therapy when we are sitting across from the person who is sharing the most intimate details of their life. But we, in addition, also are looking at, is this person interested in or other treatment modalities in terms of medication? And so we have that two-prong approach.
Thank you. All right, well, thank you all so much for joining us to answer these very important questions regarding mental health. That concludes all of our questions at this time. So what I would like to do is just go around and get final thoughts from all of our experts. So Dr. Berg, I have you up first.
Yeah, no, I learned a lot from this session. So thank you, everybody. And thank you, Courtney, for inviting me. You know, this is a difficult world that we live in right now. And I think it's just really important that we all make sure that we're supporting each other.
Thank you. Dr. Sierra, any final thoughts?
No, I enjoyed it. Learned a lot as well. And thanks for having me.
Thank you. Dr. Srinivasan, have you up next to share your final thoughts.
Yeah, I echo the sentiments. This was very, very helpful, very insightful, and I thank you for the opportunity to be a part of this wonderful panel. Thank you for hosting this, and most importantly, thank you to everyone who's on Facebook Live and participated in this and submitted questions. So thank you all for your time.
Yes. All right. And lastly, Dr. Clark.
Thank you, Courtney, for the invitation. Thank you to my colleagues and friends, Dr. Sierra, Dr. Berg, and Dr. Srinivasan. It's always good to be with my Prisma family and to have this important conversation.
Thank you. All right. Well, thank you everyone for tuning in. If you have any questions after our live, please leave them in the comments and we'll respond as soon as possible. If you would like to schedule an appointment with our providers or receive any more information, please visit our website. We look forward to seeing you all at our next Facebook Live Town Hall. Have a great day.